Once the person comes in, as long as they can tell their receptionist that they can communicate that they're here for testing, then after that we communicate whichever way is needed. And if it's writing, I always have a pad of paper right there so that, you know, we can write. Communication is very important, and even when people come in with two people in the waiting room, I have to go through that and say, okay, who is this person here? And whoever's getting tested, it's a one-to-one kind of communication. So I talk to them directly and say, is this okay if we communicate with this other person, or who is this other person? And if they indicate to me that, yes, that person is a safe person to come in, I even ask the question, but what if the test is positive? Would you want this person to know? And sometimes that even changes their mind. Morning. Okay, who's here for testing? Okay, so I have a form for you to fill out. So I will give you this and a pen. And there's two different types of testing. So we want you to choose whichever one you want. And then I need you to fill out this part here, just your first name only. And I'll be back in a few minutes. Okay.
Thank you.
Is it okay to bring in the interpreter? Is it okay for her to stay for the results even if the test is positive? I want you to read this. Okay, so it's all right? Hi, Doug. What brings you here today?
To get tested for HIV.
Is this the first time you've been tested?
Yes.
And what risk do you think you've put yourself at?
I had unprotected sex with 4 women.
Okay, and when was the last time?
3 nights ago.
3 nights ago. You realize that this test will not cover the last episode, right? What happened 3 or 4 days ago, it will not be covered under this test. So we'll have to retest you in 3 months just to cover that part. All right? When do you feel you put yourself at risk?
After the bar, unexpected, it was a last minute thing.
Okay, and is there no condoms around, or you didn't use condoms, or?
No, I didn't have any condoms around. It was unprotected sex.
Okay, well, we think everybody should be tested, and what we look for is dots. 1 dot means that you're HIV negative, and 2 dots mean that you're HIV positive, and it's just a finger prick now. And we'll give you the answer right away. Are we ready for that?
Sure. Will it hurt?
A little bit, but it's only a finger prick.
Okay.
Okay, Doug, we got some really good news for you. Your test is negative. Only 1 dot, so that means that you're HIV negative. So we'll take that as really good news, but it will not cover the episode that happened 3 or 4 nights ago is not included in this test. So we're going to have to retest you again just to cover that part. But can we give you some condoms so you can decrease your risk so that perhaps this won't happen again? So we'll give you some condoms, all right? And we'll see you in 3 months. Okay?
Thank you.
People would say, well, why can't I buy a rapid test in a drugstore? And that's a question I get a lot. The reason for that is because we do think that the pre-counseling and the post-counseling that goes on in this 20 minutes has to be done.